In 2015, the 2030 Agenda for Sustainable Development was adopted by the member states of the United Nations, which outlined the 17 SDGs, which are urgent call for action in global partnership, recognizing that in eradicating poverty and all its deprivations, strategies must be sustainable and holistic, including that of improving health and education, reducing inequality, and spurring economic growth. SDG number one, that is end poverty in all its forms everywhere, calls for strategic responses in ensuring that there is significant mobilization of resources to implement programs and policies to end poverty in all its dimensions, creating sound policy frameworks at all levels based on poor and gender sensitive development strategies to support accelerated investment in poverty eradication interventions. In the Philippines, the Department of Social Welfare and Development, or DSWD, has already developed strategies towards a comprehensive response to the needs of the poor prior to the launching of the SDGs, one of which is the Convergence framework. Despite the department's efforts to intensify the implementation of the Convergence strategy, there's only minimal number of pilot beneficiaries who have reached the self-sufficiency level. As a matter of fact, there is only 0.81% of self-sufficiency level in 2013 from that of the baseline results in 2011. There were numerous studies that evaluated poverty reduction strategies in other countries as well as in the Philippines. However, most of them do not present experiences of the beneficiaries of the SWD convergence strategies. Therefore, to fill this gap, since there is a little literature about the experiences in Region 12, particularly in Maasim Sarangani province, the researcher was interested in describing the living conditions of the participants before and after availing of the convergence program of the SWD, document the success stories which participants can share to inspire the public and account the insights that can be drawn from the participants of the convergence program. Most importantly, this study will record the best practices where inspiration can be drawn in replicating this strategy to other private or public agencies. The result of this study would significantly benefit the SWD personnel, as the findings of this study will serve as their basis in evaluating and reviewing the existing programs, policies, and guidelines of the Convergence Program strategy. This would also benefit the local government units or the LGUs, as the findings of this study can be a viable guide in implementing LGU funded convergent community projects. This can be a blueprint that can ensure the success of locally implemented convergence programs. Also, the result of this study would significantly contribute to the community beneficiaries and other stakeholders, as they can draw inspiration from how the government tried its best in helping alleviate their condition and empowering them to reach their full potential. The efforts of the DSWD may motivate them to cooperate in realizing the government's goals on their behalf. As mentioned earlier, in this study, the researcher aimed to describe the living conditions of the participants before and after availing the convergence programs of the DSWD, document the success stories which participants can share, the public, and account the insights that can be drawn from the participants to the convergence program. The researcher employed multiple case study method for this study. This qualitative method was the appropriate approach for this study because of the intent to investigate the effects of the convergence strategy of the DSWD in the lives of the beneficiaries. First-hand data were collected from the participants by documenting their experiences with the programs. Prior to conduct of the study, the researcher identified the prospective participants. There were five beneficiaries for this study who were purposely selected from among the beneficiaries in Maasim Sarangani province in Region 12, where the convergence strategy of the SWD was piloted. Based on the initial assessment, the researcher selected five participants who have significant improvement in their level of well-being as reflected in the results of the social welfare and development indicators. Only those who have benefited from the three core programs and the DSWD were selected from as research participants. Those who have significant improvements but have not availed of the three core programs were excluded. This gave the researcher the opportunity to discover success stories and how the convergence strategy was of help in realizing those successes. The study solicits voluntary participation, thus, the participants have the freedom to withdraw their consent at any time and discontinue participation without any penalty. The researcher conducted in depth interviews or IDI with key informants, focused group discussions, and validations. As discussed by Polkinghorn, case study investigates the structural consciousness in human experiences. These include procedures which the qualitative researcher should take. The researcher created research questions and interview guides that would dig deeper the meaning of life experiences for these individuals and ask these individuals to recall their experiences. The researcher also collected the data, typically via in depth interviews from individuals who have experienced the investigated phenomenon. The interview guide questions were validated by five subject matter experts prior to the collection activities. Therefore, the interview guide is warranted valid. In collecting the data, the researcher was guided by Criswell's five data collection steps. First, the researcher identified the target participants so as to know where to ask permission prior to the conduct of the study. The social work field workers helped the researcher in finding the participants. Second, the researcher personally sent the letters of invitations, permissions, and informed consent to the prospective participants for their consideration. Details of the purpose of the study were explained to them to become the basis of their informed decision. Third, when the participants agreed to the terms and conditions, they were asked to sign the informed consent. This process is very important for ethical considerations. Fourth, the participants and the researcher agreed on the place and time of the interview. The fifth was the in depth interviews, which were recorded the whole time. Participants were asked to confirm their notes, which were taken down during the interview. The purpose of this was to make sure that what the researcher have written are the correct interpretations of the participants regarding the questions raised. The data gathering process took about 2 months to be completed. After the gathering of the data, love gifts and other tokens were given to the participants as an appreciation for their willingness and cooperation in this endeavor. The researcher used content analysis in analyzing and interpreting the data in order to make sense of the data and develop core themes out of the enormous volume of the data. The goal is to emphasize an integrated view of texts and their specific contexts in order to form themes or patterns. In vivo was used to properly code the themes and subthemes. For the results of the study on the living conditions of participants before and after availing the convergence program of the DSWD. Shown in Table 1 are the core ideas and the major themes derived from the living conditions before availing the convergence program of the DSWD. The table has the major themes for the study: abject poverty, debt ridden, peaceable shelter, limited exposure and humdrum existence, poor employment opportunities, and constrained family relationship. For the examples on the abject poverty, participants shared that life was difficult. They barely meet basic needs. They can't even buy their panties, where income is only for rice and So all their clothes were hand-me-downs. For the debt-ridden, they have no regular income. They had to connect for to in-laws to borrow money and no guarantee of payment to the lenders. When their children got sick, they had to settle with Hilot because they have no money for the doctor. For the pitchable shelter, they had to live in a small hut by the hill. Their abode is a one-room wooden affair. Everything is there, and their house is made of nipa. When it rains, they get drenched. On the limited exposure and humdrum existence, they are ignorant. They have no confidence to face other people. They just stay home and assist their husband in earning a living. They are unknown in the barangay and ashamed to socialize. And they do not take part in community activities. For the poor employment opportunities, core ideas, examples are husband's livelihood is not regular. Their husband's work is so miserable, and they delivers fish without sleep or rest. On the constrained family relationship, they have no time for family bonding. They have no time to talk and have fun with their partners or husbands, and they were always fighting due to acute financial difficulty. After availing the programs, table 2 shows the major themes, which are able to afford children's education, able to meet daily basic needs, able to invest, save, and enjoy fruit of labor. Examples of the core ideas and their major themes in table 2, able to afford children's education. Beneficiaries shared that school fees are no longer a problem for the family. They were able to send their kids to school and see them graduate, and they were able to send their children through college. And samples of core ideas on the able to meet daily basic needs. The family is able to eat sufficiently and have special food as well. They were able to buy better clothing for their kids. They were able to build concrete houses, no longer a nipa hut. And they were able to put up sari-sari store and have their own electricity meter. And on the theme, able to invest and enjoy fruit of labor, they already have their SSS, PhilHealth, and some savings for children's college. They have SSS insurance. They have already accepted piece of property as pawn item. And there are added income for small business. And also, their children are now gainfully employed, and they have managed to save some money for rainy days. For the success stories, which they can share to and inspire the public, in table 3, as you can see, the major themes are able to broaden horizon and spread wings, develop as a person and learn additional skills, improved family relationship and open doors for better employment opportunities. For the insights, the major themes are Convergence program is an investment in education for Filipino youth. Convergence program is concerned with the development of Filipino family. Convergence program unites communities. Convergence program provides livelihood opportunities, and government funds should be utilized prudently and faithfully. Hence, in this study, it is safe to conclude that the Convergence program created dignity among the marginalized poor as it was able to improve their lives. The government is on the right track in maximizing the impact of its poverty reduction and social protection programs through an effective targeting system, an integrated case management, and holistic community development approach. The result of the study may also aid the development agencies in revisiting strategies in the implementation of social welfare and social protection programs and policies in response to the social sustainable development goals. These are some of the references that were mentioned in this presentation. Thank you very much and God bless everyone.